For the isotonic protocols, we need to test what 10 RM is. The isotonic protocols, or these strengthening protocols, where we're using these resistances and keeping at a certain amount of our resistance, a certain amount of our 10 RM. So test 10 RM. What it is it's the maximum weight that the person can do through full range of motion 10 times. Another thing we can do is we could test 1 RM, which is going to be a lot bigger, which is the maximum weight on only one try, full range motion. Some folks will have you do things like work at a 6 RM. So again, you just change the variable. Now, this one does have a calculator, so note the 10 RM calculation is, it's 55% of 1 RM. So the person's able to push 100 pounds, and that's it, and that equals their 1 RM. Then that would translate to their 10 RM is 55 pounds. Now, if you were looking at a protocol with something like the Zinovieff protocol, which was a descending program of only 3 sets, and the first one was 100%, the second one was 75%, and the third one was 50%, 10 RM. And each one of these was a 10x. This first one right here would be 55 pounds. This one right here would be half of 55 pounds, so roughly 27.5 pounds. So you can see, you just do the math ahead of time. Let's talk now about strengthening programs. I'm going to talk about different named programs. So these are ones where you're using a resistance or a weight. Let's talk about some of the safe ones. So the safe ones would include the SuperSlow, the Oxford, and a shortened version of the Oxford is the Zinovieff. The ones that would be more for like bulking up would be things like the traditional power, the pyramid, and also, to a lesser extent than the first two, the Delorme-Watkin. Then there's the intermediate, they have a little bit of both. There's the Delorme method, the McQueen can kind of go either which way, because both of these are based upon max possible weight. And then of course the third one is the DAPRE. Let's start with the SuperSlow. The SuperSlow program is 3 sets of 6 reps, and it's set up on a 10-4. 10 concentric and 4 eccentric. The visual I drew for this looks something like this. The weight on this one is the max possible weight. So it's, again, 6x times 3 sets with a 10-4 setup. The next one I'm going to show you is the Oxford technique. This one is pretty wonderful because it's very easy on the person. And it's a descending pattern starting at 100% 10 RM. And you're going to go down 10, 9, 8, 7, 6, 5, 4, 3, 2, 1 to 10%. So it's a 10 sets, and each one of these is 10 reps. Very easy on the body, and something that most patients can do earlier on. Now the Zinovieff is going to be set up so that it's similar, and it's going to have a starting at 100%, then a 75%, and then a 50%. There's a rest in between each one of these of 1 minute. It's a 10 reps and it's only 3 sets. These are easier on the body. Next ones I'm going to talk about are the big guys, the bulkers. The traditional power is set up so that the weight lifted is the maximum weight possible. It's 100%. And they're going to lift 10 times on that one. Then they're going to go through a rapid lifting of only 5 to 10 pound weights to fatigue. They're going to repeat this 3 times. Now the next one might be a little bit higher because it's to their ability. So they're 100% plus. And then again followed by the fatigue fast or fatigue low weight. And maybe the third one will be very big, or maybe it'll be down here. It's 100% plus plus. Always followed with this low weight fatigue. The traditional power is straightforward, and it's varied quite a bit, but it works pretty well at bulking up the muscles. The next one would be the pyramid. This one has 7 sets. The middle one is the one that's at 100% 10 RM. Then, between each set is going to be found a rest period. these rests are going to be 1 minute long. And you can see in the graphic that I did here that it's going to descend by 25% at the end, and it's going to go up from 25%, 50%, 75% to 100%, and then down, ending there. So essentially each one of these is a 10 rep times 7 sets, a variable amount of force. Let's now talk a little bit about the Delorme. It was Delorme's wife, apparently at a dinner table, that came up with the idea to call it the PRE, or progressive resistive exercises. Now this one's interesting because it is to what the person's max weight they can handle, so there may be some variability. And there are 7 to 10 sets. The frequency is anywhere from 10 to 15 reps. And again, the weight is whatever they could handle, so this may actually kind of go up and then go down and up, depending on the person's abilities. The Delorme-Watkin is a progressive method, and it will look like this, where we're going to start at the 50, go to the 75, and then go to the 100%, 10 RM. It's a very straightforward 10 rep times 3 sets. The McQueen is another way to do this, and this one is actually kind of a combination of these two if you think about it. It's 3 sets, and then it's dependent on that person, so they might go up. It's the max weight possible, and each one is a 10 rep times 3 sets. The DAPRE is probably the most famous of them all. It stands for Daily Adjustable Progressive Resisted Exercise. And it's going to have a first set of 10 reps at 50%, 10 RM. The next one's going to be only 6 reps at 75%. And then the last one is going to be as many as the person can do. So we'll put a dotted line here because they might be able to do a lot more or maybe a little bit less, depending. So it's the max number of reps. And this one's at the 100%. This set number 3 is going to determine what the 4th set looks like. Will the 4th set look littler? Will it look bigger? So the 4th set's the unknown. So the way this works is if set number 3, max weight, max reps rather, is 5 to 6 reps, then set 4 is going to be the same. And the next visit will be determined also by this. If it's 4 to 5 reps they can do during this part right here, then we're going to bring it down a little bit. And we're going to go down 0 to 5 pounds depending. If it's 3 or below reps, then we're going to knock it down a lot, 5 to 10 pounds. So this one right here is kind of like where your goal is. If it's 7 to 10 reps, then it's too easy. So what we're going to do is we're going to increase it now 5 to 10 pounds. And if it's 11 or greater reps, then what we're going to do is increase it 10 to 15 pounds. Now the next visit. If they were only at 4 to 5 reps during the third set, we changed it up, and then we're going to keep this one the same. If it was just a low amount of reps, it's going a little bit too fast. We maybe need to bring it back a smidge. So we're going to bring this down 5 to 10 pounds depending on how it works for that patient or that participant. This one here, where we've got our 5 to 6 reps right in here, we felt pretty good about it. We kept set number 4 to be identical to what we just did. Next visit, we're going to bump it up a smidge, 5 to 10 pounds higher. If we made it into the 7 to 10 reps during the third set, our next visit, we're actually going to go up 5 to 15 pounds. And then the last one, if it was so easy and we did 11, we bumped it up quite a bit on the fourth set. And next visit, what we're going to be doing is it's going to be up 10 to 20 pounds. So the daily adjustable progressive resisted exercise allows us to kind of take a peek at how we do, and it helps us determine that last set and also the next visit.